Warts are small, non-cancerous skin growths caused by the human papillomavirus, HPV. These common skin growths can appear on various parts of the body, and they often look like small, flesh-colored, rough bumps on the skin's surface. Warts develop when the HPV virus infects the top layer of your skin, usually through tiny cuts, breaks, or other vulnerable sites. The virus then causes excessive growth of cells on the outer layer of skin, creating the characteristic bump or growth we recognize as a wart. These growths might seem like simple skin blemishes, but they actually represent the body's infected skin cells that have been transformed by the virus. The HPV virus stimulates the skin cells to multiply rapidly and also causes the blood vessels in the area to clot and form those tiny black dots you might see in some warts. These aren't wart seeds, as some people believe, but rather small, clotted blood vessels. One important thing to understand about warts is that they're contagious. They can spread from one part of your body to another through direct contact, and they can also be transmitted from person to person. However, not everyone who comes in contact with the virus will develop warts. Your immune system plays a significant role here. However, what's really annoying about warts is that they can persist for months or even years if left untreated, and in some cases, they can become painful or interfere with your normal activities. Types of warts. There are several distinct types of warts, each with its own characteristics and typical locations on the body. Number 1. Common warts. These are the most frequently seen type, appearing as rough, grainy bumps, often found on the hands, fingers, knees, and elbows. They may have the small black dots on the surface, which are clotted blood vessels, sometimes called wart seeds. The color here ranges from flesh-colored to white, pink, or tan. Common warts are usually painless unless they're located in areas subject to frequent pressure or friction, such as fingertips or near nail beds. Number 2. Plantar warts. Plantar warts develop on the soles of the feet. Unlike other warts that project outward, plantar warts are often flat or slightly raised due to the pressure of walking, which pushes them inward. They typically have a rough surface with a well-defined boundary and may feature small black dots. Unlike most other warts, plantar warts can be quite painful, especially when walking, as they feel like having a stone in your shoe. Number 3. Flat warts. These are smaller and smoother than other types. They typically appear in large numbers, sometimes in the dozens or even hundreds, and commonly affect the face, legs, and arms. In men, they often appear in the beard area, where they can be spread through shaving, while in women, they frequently develop on the legs. Number 4. Filiform warts. These have a distinctive finger-like appearance, with thread-like growths that project from the skin. They typically appear around the mouth, nose, eyelids, or neck, and grow quite rapidly compared to other types. While these warts aren't usually painful, their location on the face can make them particularly noticeable and bothersome from an aesthetic perspective. Number 5. Genital warts. These warts are sexually transmitted, and they appear on the genitals, pubic area, or in and around the anus in both men and women. They may be small, flat bumps or larger, cauliflower-shaped growths, and are caused by specific strains of HPV that are different from those causing warts on other parts of the body. These warts may cause itching, discomfort, or bleeding during intercourse, though many people with genital warts experience no physical symptoms at all. Genital warts require special medical attention, as some HPV strains associated with them can increase the risk of certain cancers. Number 6. Periungual warts. These form around and under the fingernails and toenails. These warts can be especially troublesome because they can affect nail growth and cause pain when they press against the nail. Symptoms of warts. Beyond their visible appearance we just explained, warts may cause several associated symptoms. Tenderness or pain can occur when warts are subjected to pressure or friction, particularly with plantar or periungual warts. Bleeding is common when warts are scratched, cut, or otherwise injured, as they contain small blood vessels near the surface. Itching sometimes occurs around or beneath warts. However, this isn't a universal symptom. Some people also report a feeling of roughness when touching the affected area, which can be particularly noticeable when warts develop on the fingers. It's important to note that warts can change in appearance over time. They may grow larger, multiply, or develop a rougher texture. Some warts, especially plantar warts, can merge to form mosaic patterns covering a substantial area. In rare cases, particularly in people with weakened immune systems, warts can grow quite large or spread extensively, requiring more aggressive treatment approaches. While most warts are harmless, some other serious conditions, including certain types of skin cancer, can resemble warts. So, if you notice unusual changes in size, color, or texture and you're concerned, watch this video to learn the key differences and when to get checked by a doctor. Causes of warts. Warts are caused by various strains of the human papillomavirus, HPV, which is a family of more than 150 related viruses. Different HPV types tend to cause warts in different body locations. For example, HPV types 1, 2, and 4 commonly cause hand warts, while types 6 and 11 are often responsible for genital warts. The virus enters the body through tiny cuts, breaks, or other vulnerable areas in the skin's outer layer. Once inside, it infects the skin cells and causes them to grow rapidly, forming the excess tissue that becomes a wart. The transmission of the virus occurs through direct contact with a wart or through indirect contact with surfaces or objects contaminated with the virus. For example, you might contract the virus by touching someone else's wart, by sharing towels or razors with an infected person, or by walking barefoot in public showers or pool areas where the virus is present. Your risk of developing warts after exposure to HPV depends on several factors. Immune system function plays a crucial role. People with conditions that suppress the immune system, such as HIV or those undergoing chemotherapy, are also at a higher risk. It's worth noting here that the virus can remain dormant for weeks or even months before a wart appears, making it difficult to determine exactly when or where exposure occurred. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of warts. Diagnosing warts is typically straightforward for doctors, as these growths have characteristic appearances that distinguish them from other skin conditions. During the examination, your doctor might use a dermatoscope, which is a special magnifying device with a light source, to examine the wart more closely. Through this instrument, the doctor can often see tiny black dots, those clotted blood vessels we mentioned earlier, which are a hallmark feature of many warts. If a diagnosis is uncertain, a biopsy may be performed by removing a small section of the wart and examining it under a microscope. This is particularly necessary if a growth appears unusual or does not respond to standard treatments. It's worth noting that many people accurately self-diagnose warts, especially common warts and plantar warts, based on their characteristic appearance. However, if you're uncertain about a growth, if it changes rapidly, bleeds easily, or causes significant pain, it's always best to consult a doctor. This is particularly important for growths in the genital area, as proper diagnosis and treatment can help prevent transmission to partners. Treatment for warts. Number 1. Wait and see approach. One legitimate treatment option, particularly for children and individuals with small or few warts, is simply waiting for them to resolve on their own. About 2/3 of warts will disappear without intervention within 2 years as the immune system eventually recognizes and fights the virus. During this waiting period, you can cover the wart with a waterproof bandage when in public places like swimming pools to prevent spreading the virus to others. You should also avoid picking or scratching at warts to prevent them from spreading to other parts of your body. Number 2. Over-the-counter treatments. Several non-prescription treatments are available for treating warts at home. Salicylic acid is the most common active ingredient in over-the-counter wart remedies and works by gradually wearing away the infected tissue. These products come in various forms, including liquids, gels, pads, and patches, with concentrations typically ranging from 17% to 40%. For effective treatment, you should soak the wart in warm water for about 5 minutes, then gently file away the soft and dead skin with an emery board or pumice stone. After drying thoroughly, apply the salicylic acid product according to package directions, usually once or twice daily. This process must be repeated consistently, often for several weeks or even months, as salicylic acid works gradually. Success rates range from 50% to 80% with proper application and patience. Number 3. Cryotherapy. This is one of the most common professional treatments for warts. Cryotherapy involves freezing the wart with liquid nitrogen. During the procedure, your healthcare provider applies liquid nitrogen directly to the wart using a spray device or cotton swab. The extreme cold temperature creates a blister between the wart and the underlying skin, cutting off its blood supply. As the area heals, the frozen tissue falls off, taking the wart with it. The procedure itself takes just a few minutes, but can cause significant pain that peaks about 10 minutes after application and gradually subsides. Multiple treatments are usually necessary, spaced 1 to 3 weeks apart, with an overall success rate of about 70%. It should be noted that cryotherapy is less successful for plantar warts because the thick skin on the sole of the foot makes it difficult for the freezing to penetrate deeply enough. Number 4. Laser treatment. Laser therapy has become an increasingly popular option for stubborn warts that haven't responded to other treatments. The most commonly used is the pulsed dye laser, which targets and destroys the small blood vessels that supply the wart, essentially starving it. Another option is the carbon dioxide laser, which vaporizes wart tissue layer by layer. Before treatment, the area is numbed with local anesthetic to minimize discomfort. The procedure itself takes 10 to 20 minutes, depending on the size and number of warts being treated. Most patients experience a sensation similar to a rubber band snapping against the skin during the procedure. Multiple sessions, usually 2 to 4 spaced about a month apart, are often needed for complete removal, with success rate ranging from 60% to 80%. Number 5. Prescription medications. When over-the-counter treatments fail, doctors may prescribe stronger medications like imiquimod, which stimulates the immune system to fight the virus. This cream is often used for genital warts and other stubborn wart types. Another prescription option is cantharidin, a blistering agent that causes the wart to peel away over time. These treatments can cause mild irritation or redness, but are generally well tolerated. Number 6. Surgical removal. For persistent or painful warts, minor surgical procedures can be performed to cut or burn off the wart. This method is usually reserved for warts that do not respond to other treatments. While surgical removal provides immediate results, it may leave a small scar, and there is a risk of the wart returning if any viral cells remain in the skin. While medical treatments can be very effective, many people prefer natural remedies to get rid of warts at home. If you're looking for safe and effective ways to treat warts at home, check out our video on 9 powerful home remedies that might just do the trick. At the end, while warts can be persistent and sometimes frustrating to deal with, most respond well to treatment, and many resolve on their own with time. If you're concerned about a wart, or if home treatments aren't effective, consulting a doctor will help you determine the best approach for your specific situation. Now, we want to hear from you. Have you ever had a wart that just wouldn't go away? What remedies or treatments worked best for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.